Social health determinant, education. A closer look at the links between the level of education and the health of individuals and communities. Social determinants of health. The economic and social conditions under which people live will help to shape their health. In other words, someone with a high school education will have better economic and social opportunities than someone who does not. Someone who has a college-level education will have even better possible outcomes, etc., and so on. A person's level of education directly affects their personal health. As we said before, the more you study, the better you do in school, the healthier you'll be. Recognized by the World Health Organization as a major factor of personal well-being. Those who have higher levels of education have healthier, happier lives. The Healthy People 2010 report found that inequalities in income and education underlie many health disparities in the United States. In other words, there are some who are rich and some who are poor. Those with less money and less education had many more health problems. Life skills gained through proper education. Interpersonal skills, professional skills, self-esteem, community involvement, awareness of personal health. So basically those who have better levels of education have better self-esteem and better life skills, and therefore better health. Illiteracy and lack of education have been associated with poverty, malnutrition, infant mortality, and chronic illness. While the lack of education isn't necessarily the cause of these problems, they have been found to go together. Poor health outcomes have been associated with difficulty learning and adapting healthy lifestyles, being unable to pass healthy lifestyle skills to children. As you can see in our little graphic down there, some unhealthy lifestyle choices, and people who have not been able to adapt healthy lifestyles will create a cycle where those unhealthy lifestyles are passed down to the next generation. Looking at a little history of how education directly can save lives, germ theory helped educate the public about how to prevent the spread of disease by hand washing, covering your mouth when coughing, proper food storage. When we look at the Spanish flu pandemic, it was discovered that just simple things like covering your mouth when you sneezed or washing your hands helped fight the spread of that disease and probably saved millions of lives. Back to Healthy People 2010, a case study of 25 to 64-year-olds with less than a high school education in Washington State found they had higher rates of smoking, higher rates of obesity, less access to healthy foods, exercise, equipment, and areas to exercise, and obviously higher death rates. So again, we see a direct connection between level of education and health outcomes. Healthy People 2010 also found that a person's overall financial status and work experience, or their socioeconomic status, was directly tied to having better overall health, or less education meant more overall health problems. Health literacy is the basic understanding of health information. This is very important when it comes to things like filling out medical forms, locating a doctor or a specialist that someone or a family member might need, or managing an illness or trying to prevent an illness. So those without health literacy may find problems with trying to manage a sickness or stay healthy. People who do not have at least basic health literacy tend to be in poorer health, have more hospital visits, and seek less preventative care. In other words, they are sicker often, they don't know how to take care of themselves properly or prevent certain illnesses. They wind up in the emergency room a lot, and of course we know how this affects the public health system and insurance rates, etc. So as we have seen from these examples, a person's level of education is very important